Case 14. A 21-year-old man and his mother visit the clinic because his daytime sleepiness is interfering with his studies. The man is slightly obese and has a history of pulmonary hypertension. His mother says that he has a medication for sleep, but that he does not use it. On questioning, the man says he has a prescription for amphetamines and is taking sertraline. His mother also mentions that while they were in the waiting room, the man heard bells ringing, which no one else heard. Shortly thereafter, the young man fell asleep during the conversation. What is the diagnosis? The hallucinations, sudden onset of sleep, and amphetamine treatment are consistent with a diagnosis of narcolepsy. The condition has a strong genetic component. What kind of hallucinations is the patient having? Hallucinations that occur before falling asleep are termed hypnagogic hallucinations. Gogic, or go, like as in go to sleep, so they happen before falling asleep. Hypnopompic hallucinations occur during waking and are associated with narcolepsy also. What are the 4 classic signs and symptoms of this diagnosis? The 4 classic signs and symptoms of narcolepsy are cataplexy, which is a sudden transient loss of muscle tone ranging from mild weakness to full body collapse. Sleep paralysis, the inability to talk or move upon waking or falling asleep. Hypnagogic hallucinations, excessive daytime sleepiness. What sleep stage is the patient likely to enter immediately after falling asleep? Narcolepsy is associated with rapid eye movement, sleep within 10 minutes of falling asleep. What behavioral and pharmacologic therapies can be used to treat this condition? Central nervous stimulants, e.g. methylphenidate and amphetamine, are used to treat excessive daytime sleepiness, and tricyclic antidepressants, e.g. clomipramine and imipramine, are used to treat cataplexy. Lifestyle changes, including reducing stress, increasing exercise, and taking frequent daytime naps, can also be therapeutic. What other electroencephalographic or EEG abnormalities might be expected in this patient? Sertraline, a selective serotonin reuptake inhibitor, suggests depression. Depression is associated with decreased REM latency, or REM latency, and decreased stage 4, which is or slow wave sleep. Effective treatment with antidepressants, however, usually reverses EEG abnormalities caused by major depression. What other common sleep abnormality might account for poor quality of sleep? Obesity and pulmonary hypertension are associated with sleep apnea, which can be disruptive and can lead to significant daytime fatigue. Arrhythmias and loud snoring are also associated with sleep apnea.